So basically, we have an anxious person, we have an anxious patient at our hand, and he's suffering from a psychiatric disorder in which he's having extreme fear or extreme worries in his mind, which is affecting him physically as well. He's having the physical symptoms along with it. The history taking, again, is very important over here if you want to know the etiology behind this anxiety disorder. Etiology is basically the basic purpose cause of that particular condition that we're talking about. It can be any condition, any pathological condition. So over here, when we are discussing the anxiety disorders, the etiology, as we've already discussed, is it can be a substance abuse. It can be other somatoform disorders as well. A person can suffer from cardiovascular diseases, respiratory diseases, neurological diseases, as well as the person can suffer from some endocrine disorders. So a lot of endocrine disorders will result in the generalized anxiety disorders as well. So a complete medical, a complete surgical history is again very important whenever we are looking for the cause of anxiety in a particular individual. And then some people are having the borderline personality and they are prone to develop this generalized anxiety disorder. So the corroborative history, which is taken from the relatives and which is taken from the friends, is again very important whenever we are considering such a personality, and that will basically give you clues towards the personality of the person before he had this problem at hand. So in this section we'll be discussing the substance misuse. Substance misuse can sometimes lead towards this generalized anxiety disorders, and then we can have neurosis as well. A lot of neurotic conditions can still result in an anxiety disorder. The aetiological factors and the clinical assessment, whenever we have a patient at hand, we have a complete detailed history of that. We get the complete detailed history from that patient. We get a corroborative history from his relatives as well as his close friends. And then we're going to assess the patient whether he's suffering from a mild, moderate, or an extreme form of GAD, which is basically the generalized anxiety disorder over here that I'm referring to. So the drug intoxication, that I've already focused upon the fact that it's very important that we get the detailed drug history. If he's allergic to some kind of drugs, if he is basically misusing or is an addict to some kind of drugs, or if he's using some kind of drugs for a longer period of time. So all of these will basically give you clues towards the cause of the anxiety disorder. The drug intoxication with cocaine and amphetamines is very common. So these are the drugs of addiction that we have to consider in our mind. Then the medication side effects. Any long-term ailment and the person is basically taking a lot of medications, that can again, a lot of medications can result in the anxiety disorders. That include the theophylline, that include the steroids, and the anticholinergics. So steroids are quite notorious for producing this kind of anxiety disorders in a lot of individuals. Then withdrawal states, if a person is on a drug of addiction and he's withdrawn, during that withdrawal time, he's going to suffer these anxiety attacks or these panic attacks. And from benzodiazepines and alcohol, withdrawal states will give you a typical picture of GAD, that is generalized anxiety disorders. Then caffeineism is again one of the causes of the generalized anxiety disorders. And the primary anxiety disorders is one of the type of the anxiety. Then we have the generalized anxiety disorders, we have the panic disorders, and then we have the agoraphobias with or without the panic disorders. Agoraphobia is basically a phobia or a fear to closed spaces, and whenever a person would be in closed spaces, for example in elevators, he'd get that fear, he'd get that panic attack. So sometimes these agoraphobias are associated with panic attacks and sometimes they're not associated with panic attacks. So the social phobias, that he would not be very good at the social interactions, and so we can label that person as a social phobic person. Then there are specific phobias towards specific objects, and it can be towards the animals, it can be towards any stimuli, and he can get phobic to those stimuli. So these are basically the typical types of anxiety disorders that we usually come across. Now, anxiety can occur due to some neurological conditions as well. So, complete assessment and a complete past medical and surgical history is again very important. The paternal natural affections of sense and motion, and with pyrexia, without pyrexia. Pyrexia is basically an increased body temperature. So basically, these anxiety disorders can arise due to an elevated body temperature as well, as a part of a primary disease and characterized by unimpaired reality testing again. Now, the ICD-10 classification system again is very important to emphasize upon whenever we are talking about the anxiety disorders which arise due to the neurosis or due to the neurological problems. There are a lot of etiological factors that we have to consider. It's not a homogeneous group, as we've already discussed. It can be when you take a complete history, a lot of factors would be highlighted. It can be a past history, even an incident from childhood can reflect in the present day psychology of a person. So we have to get a complete history. It can be the relationship history, the drug history, the sexual history, the corroborative history. All of these histories would give you clues towards the etiology of the anxiety that the person is currently suffering from. The pre-existing personality traits are to be dug out after you get a complete corroborative history. The psychosocial stress is very important, and the degree of the social support. Social support is basically quite weakened in the developed countries, and so they do not have a complete family system that is providing support to that individual. So sometimes the individuals get anxious in the particular situations. Then the genetic factors, they're quite less important, but they have to be considered as one of the factors of the production of this GAD. A lot of anxiety disorders, they show heritability, like the panic disorders and the agoraphobias. Panic disorders in family, the risk increases by 4 to 7 times. GAD is basically 5 times increased risk if the relative is affected from GAD. Then the person is basically 5 times more prone to developing this GAD. There's an increased risk of alcoholism in these individuals as well. There is reduced effects if milder cases are examined in such cases. The clinical assessments of such anxious disorders or anxious individuals is when the problem is basically they're anxious and depression. It's basically correlated and it's usually present together. Neither is clearly predominant in such individuals. Taking a complete and detailed history is very important over here. The mental state examination, abbreviated as MSC, is taken in detail in a complete way in such individuals. The physical health problems are excluded in such individuals, and the anxiety in depression and psychotic disorders is basically another variant that is usually present in such individuals. So basically in this section, we focused on the fact that how do we get to the etiology of a particular anxiety disorder in a particular individual, and how can we exclude some of the conditions from it. So that is the end of this section. Thank you for watching sqadia.com.